and a community organizer at heart. She brings together a grassroots perspective and policy analysis for women informal workers for a well-rounded organizing effort of women movements. So Ms. Bhattacharya will share insights in the urgent demands and recent positive advancements made by domestic and care workers in the ASEAN region. I think I'll take a seat too. Next, we are honored to have a representation from UN Women as well, Ms. Amy Baum, who serves as a consultant supporting the Women's Economic Empowerment Portfolio at the regional office. Since 2020, she has conducted research and developed briefs to guide gender-responsive private sector response strategies to COVID-19. She has also supported the development and implementation of programming and research on innovative market-based approaches to transform the care economy, and is currently the program lead for the newly launched second iteration of Asia Pacific Care Accelerator. Ms. Baum will be joining us online, and she will shed light on the care workforce from the perspective of innovation in the care economy. Lastly, we are privileged to have Ms. Jane Sloan as well, who is the Senior Director of Women Empowerment and Gender Equality in the Asia Foundation. She has over 20 years of experience in advancing women's rights. Her previous roles include being a Vice President of Programs at Global Fund for Women. She was the Vice President of Development at Women's World Banking and was an Executive Director for International Women's Development Agency. And she could not join us today online or in person, but she has sent in a pre-recorded message, which I will play in her section. Ms. Sloan will discuss the emerging opportunities and challenges in the care workforce and what the Asia Foundation have been working on in the Asia Pacific. And with that, I would like to begin with my first question to Ms. Rania. So, the International Domestic Workers Federation advocates that domestic work is work, and all domestic and household workers deserve to enjoy the same rights as all other workers. In the context of the ASEAN region, what would you say would be the most urgent and pressing demands being put forward by domestic and care workers? And I would also ask if you could share some, if you could highlight some positive advancements that have been made in these areas.
Absolutely. Thank you, Saleha. Hi, everyone. My name is Reina, and I'm from the International Domestic Workers Federation. We are a federation of domestic worker unions across the world. And in ASEAN, we have our presence in 5 countries, which is Indonesia, Philippines, Thailand, Malaysia, and Cambodia. And I would also like to point out that in Malaysia and Thailand, we are working with migrant domestic workers who are essentially coming in from different countries of origin. Recently, actually, with the support of Oxfam Canada, we did something interesting. We embarked on a care policy mapping for certain countries in Asia. And the aim of this mapping actually was to identify the care policies that exist across sectors and departments in these countries, to identify what is the present care burden, what is the extent of care that is required in these countries, and how much of it is actually being shouldered by paid care workers, such as domestic workers. This is also important in relation to the data collection problem that we have been facing with regards to the care economy, and this is an attempt as a solution to that. So in the ASEAN, we actually did it for 4 countries. We did it for Thailand, Philippines, Indonesia, and Malaysia. And we have a few findings that interestingly have been discussed already, and some findings that we want to shed light on. First is something that Her Excellency from the government of Brunei pointed out, that across these sectors and across these contexts, the care burden is actually projected to increase in all of these 4 countries in the next few years, as all of these are either aged or aging. And as has been spoken before, the intersection that is most affected by the phenomenon of aging is our rural women with very little access to social and economic protection. And secondly, the social norms plus the government policies on care across these countries prioritize family-based care and home-based care. which means that home-based care is prioritized and incentivized over institutional care. And secondly, because of that, the burden of unpaid care work falls mostly on the woman in the family because of its gendered nature of such work. So in such a situation, across these contexts, because of this burden, the labor force participation rate for women is much lower than that of men. And that was addressed from our colleague from Malaysia. And secondly, we are seeing that these societies are moving away from multi-generational families to nuclear families. And therefore, access to women caregivers in the family are also becoming slowly limited. So in such a situation, to ensure and enable that women participate in the labor force, and also that people needing care should get the adequate amount of care, the dependency on paid care workers, such as domestic workers, is vastly rising. So when it comes to the care infrastructure across these contexts, all of these contexts, there is both public and private infrastructure. But the public infrastructure is mostly aimed at low-income families and therefore may not cater to the entire care demand. We have a few stats here, like for example, to just focus on childcare, we found that only 20% of the eligible children population benefited from center-based childcare services in the Philippines. In Indonesia, of the 52.5 million children in the preschool age, only 45.6% are participating in preschool education. And the other side, when it comes to paid care workers, such as nurses and healthcare workers, whose skills and training are recognized, they are part of the private care infrastructure that becomes expensive and unaffordable, therefore leaving a huge care demand. And therefore, this demand is being met by reliance on informal structures. And a vast majority of this structure are domestic workers. For example, in a 2018 study, the Social Security Office in Thailand estimated that there were 1.2 million households with domestic workers, and that there were 1.5 million domestic workers nationwide. In Indonesia, there are 4.5 million domestic workers, and this does not take into account the migrant domestic workers that leave Indonesia as the country of origin to other countries of destination. The care services that domestic workers provide, we work with domestic worker unions, we work with them closely, and we see that they can be divided into two categories as recognized by the ILO, which is the primary care, which is essentially direct care that is provided to the elderly, the disabled, and the children, and then secondary care, such as cleaning, cooking, washing, activities that provide ancillary support to primary care. But if you look at the living and working conditions of local and migrant domestic workers who are shouldering the burden of care, then they have very limited or almost no access to decent work conditions. If we look at it from the ILO 5R framework on care, the first R, which is recognize, in most contexts, domestic work is not recognized as work. It is not recognized as care work and are therefore not included under the purview of labor law. In most cases, domestic workers work very long hours and very little pay. In fact, we have a few stats from this research that in the Philippines, for example, 36% of the live-in domestic workers work 7 days a week without any rest day. In Thailand, migrant domestic workers are working more than 14 hours a day. And because they are live-in, they are on call 24 hours a day. Domestic workers do not come under the purview of minimum wage as well, guaranteed to other workers. In Indonesia, for example, the monthly wage of a domestic worker is only 20 to 30% of the regional wage, of the regional minimum wage. Therefore, if we look comprehensively at the 5R framework, none of the R's are being met when it comes to domestic workers. Philippines has ratified C189, which is the Convention for Decent Work for Domestic Workers. But we also found that only 41% of domestic workers in the Philippines are aware of the existence of the Kasambahay law. And when it comes to rewarding and the reduction of the care burden, we've also found that employers actually take advantage of the informality of the sector and the fact that the skills acquired by domestic workers over time is not recognized. So given the situation that we have at hand, given our work with domestic workers and our conversations with them, to all the governments present here, we have a list of very clear six asks. Our first ask is that legislate wage protection for domestic workers, which means that we need laws for wage protection, including minimum wage law and protection against unpaid wages or underpayment of wages. Our ask number 2 is that recognize domestic workers and as care workers, and include domestic workers in the labor law and in the care agenda. Ask number 3 is domestic workers should have access to weekly day offs and holidays. Number 4, domestic workers should have access to social protection, including maternity benefits. Number 5, domestic workers should have regulated working hours. And number 6, the sixth hour that is most important, is bringing domestic workers' representatives to the negotiating table. If there is any conversation that is happening on paid care work, the care sector, and care workers, domestic workers should be represented at the negotiation table, making those negotiations. And since you asked about successes, Saleha, there have been a lot of successes that we have seen when it came to paid care work advocacy in some of these contexts. So for example, since 2021, migrant domestic workers in Malaysia are included under SOCSO, which is the Social Security Organization scheme, and it was extended to migrant domestic workers in the advocacy, in the phase of advocacy that was done by our workers on the ground, and in the midst of COVID-19 pandemic, which highlighted the difficulties that migrant domestic workers face when it came to the pandemic. In this case, however, it is the mandate of the employer, which means that the employer must register the worker and provide the employer contribution for the scheme. And that we have seen migrant domestic workers being enrolled for that scheme. And in Indonesia, a total of about 81 domestic workers have been registered in the BPJS, which is the Employee Social Security System, even though it is not legally mandated to do so. This is done purely by the goodwill of employers on the ground. Therefore, employers are invested in the process of providing decent care to domestic workers. So therefore, with stronger advocacy and political will on the part of governments, it is possible to think of a scenario where domestic workers can get access to basic rights and decent work as workers. Thank you so much.
Thank you, Raina. Thank you again, Raina, for sharing your valuable perspectives, especially on how our dependency on relying on informal and domestic workers is only increasing with almost little to no protections in place. I hope this is something we can also discuss and think on in tomorrow's group discussions. And thank you again for sharing the demands you have and the advancements that have been made by domestic workers. That's always a positive note to end. And I think we're good on time. So my question is for Amy Baum from the UN Women. We would like to discuss the care workforce from the lens of innovation in the care economy. We have recently heard that about an upcoming piece of research on digital enabled care enterprises by the UN Women. Could you share some insights into UN Women's work on care entrepreneurship? Any other practical programs in the area within the ASEAN region? Over to you.
Yes, thank you so much, Saleha. Can you just give a thumbs up that you can hear me all right? Perfect, great. And can I go ahead and share my screen? I think if the other participant stops, I'll be able to. I have just a few slides to walk everyone through. Great, fantastic. Okay, I'll start sharing now. I'm sorry I can't be with all of you there in person, but thank you so much for inviting us to be part of this panel discussion. And I see lots of friends in the room who we've encountered through the past couple of years as well, that we've been working on our different approaches to the care economy. So I'm going to talk a little bit today specifically about inclusive care entrepreneurship and how UN Women has been approaching that as an entry point to women's economic empowerment within the context of transforming the care economy in the Asia Pacific region. So I'm going to go a little bit quickly because I have a lot to pack in, but I'll be sharing the slides and then links of different documents that we mentioned, and then it will be available for questions just after. So in looking at kind of innovation in the care economy and things that we saw coming out of COVID-19, we've been exploring inclusive care entrepreneurship as a potential market-based solution, and also looking at blended care delivery models and approaches to fill the care and supply demand gap that we know exists and is only growing with the given demographics in ASEAN. So one of the first programs we did with this was called the UN Women Care Accelerator in 2021, where we took a group of 13 care businesses from across the region through an acceleration program that had business acceleration skills, but also learnings about how to become a gender responsive business. So we leveraged these We Rise toolkits that you can see here that UN Women developed for entrepreneurs and accelerators to support entrepreneurship support organizations to actually become more gender inclusive in delivering their programs. And a lot of the insights that came out of this first Care Accelerator and some of the learnings were captured in this think piece that we published last year. And we honed in a little bit on childcare entrepreneurships to keep our focus a bit narrow, but we looked at innovations in childcare that could advance women's economic empowerment. And as you see on the left, what we've been exploring and learning is really that if we have inclusive care enterprises that also have a gender responsive lens in their business towards their customers and their care workers, and if enabled by the right policy and regulatory environment, the care entrepreneurship can be a pathway towards providing more formalized paid care work and decent working jobs for care workers. So we've just recently launched a new program actually this year coming out of this called GSIP, or the Gender Inclusive Care Entrepreneurship Ecosystem Program. So with this, we just launched a second iteration of the Asia Pacific Care Accelerator. It's a longer program, and it's going quite a bit deeper into the gender elements and specifically looking at how care enterprises can grow with sustainable business models that are gender inclusive and provide good working opportunities for their care workers while also providing affordable quality care for their customers. And we have, again, 13 enterprises, and we just kicked off this program last month. What we also did with this new program is add an additional pillar looking at low-income base of the pyramid solutions through a range of care delivery models, whether they're market-based, community-based, or cooperative models, are also working with the government, and that will be piloting in India and Bangladesh. So stay tuned for more about that program. Another thing that we just did last month that I wanted to bring people's attention to, and there's a QR to download the outcome paper, but I'll also share the link with everyone. So we convened a bunch of the stakeholders together on the sidelines of the ABPN social investment kind of global conference to look at what's really needed to drive this inclusive care entrepreneurship ecosystem together and look at innovative care delivery models across the market spectrum. So we brought everyone together for 2 days in Kuala Lumpur, and really this outcome document that was just published last week kind of consolidates a lot of our learnings in the past few years. We had a lot of different stakeholders come from across the region to put forward recommendations and insights, what we need from policymakers, from investors, from ecosystem players, and from entrepreneurs themselves. So I encourage everyone to check that out, which is hot off the press. What I really want to present today, and Saleha touched on briefly, and it also intersects with quite a bit of what we just heard from Reina. We'll be launching in the next few months a new piece of research, and I want to present just a few key highlights today with trying to stay in my time limit. So coming out of our think piece and our implementation of the Care Accelerator, we've been working over the past year on a research piece called Pathways Towards Decent Work in the Digitally Enabled Care Economy, Emerging Realities in Southeast Asia. So this research has really had the aim to identify and illustrate potentially good practices of digitally enabled care enterprises and market-based models in the care economy, and assess the potential role that they play in generating work opportunities and pathways that can move care workers closer to decent work. So knowing that the rise of online labor platforms is increasing exponentially in ASEAN, we just saw the most recent employment outlook focused on the digital economy and decent work. We know that a lot of the emerging research tends to focus on more male-dominated sectors, looking at the platform economy and decent work. And we didn't see anything yet that had explored the realities of platform work in the care economy. But we saw some of this emerging with our work on care entrepreneurship. So we wanted to study this. So what we did is we've been working with 4 enterprises that were part of our previous care accelerator in Indonesia, Malaysia, Thailand, and Singapore. I'll kind of gloss over some of the details today, but these had a variance of migrant workers and national workers. They're not registered as care enterprises for the most part, but all of them are using some level of technology to mediate their relationship between the worker, the client, usually families, and the enterprises. And so you'll see this funny acronym here, this DECE. So with no internationally agreed or statistical definitions really of the care economy, care workers, or also the arrangements of the digital care economy, we've coined this term for our research, digitally enabled care enterprise, or DECE, and the workers within that digitally enabled care workers, DECWs. So we applied a mixed methods approach for this research using qualitative instruments and qualitative as well, having literature review and a quite extensive policy review. I do just want to acknowledge just briefly up front that the study is not meant to be a representative sample or generalizable. And we know that there is some, if you could call it embedded positivity, that the fact that these 4 enterprises we engaged are signatories to the women's empowerment principles, and they did go through our care accelerator. So these are already businesses that are fairly committed to gender equality. So I want to present today, and I'm cognizant of my time, just a few of our kind of key highlights, findings, and recommendations that are coming out of this, and then will be shared soon. So I think the first one that was really surprising to us and kind of challenges some of the traditional views of care workers in the region with offline care work is that we saw that our DECEs attracted skilled, young, and highly educated workers. The majority were under 39, and we saw that 49% had a university degree. Many of them had several years of experience working in the care sector. And then I think another important thing to note is that 80% did not have additional jobs. So we're not really seeing that DECs are adding to the labor force, but that we do see a lot that are moving to DECs as their primary source of employment, not as a secondary or additional source of employment. So really at the core of our research was looking at exploring how these enterprises can provide pathways to support the path towards decent work. So in looking at how they facilitate these pathways, we've utilized Sabina Dewan's framework of the critical dimensions that assess benefits and challenges for women in the platform economy that she prepared for the CSW meetings. So her 4 dimensions were flexibility and autonomy, entitlements and protection, income, and representation. And you can see how we've clustered these a little bit. Again, I'm just going very briefly through some of these, but we really saw that for our care workers, the main 3 advantages they listed were safety, income, and then learning. And then you can see some detail within the report on variations within the level of digitization and how that affected some of their answers. In terms of entitlements and protection, 88% noted that they have a written or oral agreement for the provision of their services, whether that's with the platform or with the family, the employer, and 77% noted that the enterprise had a role in enabling these agreements. So we did see them as quite active intermediaries that facilitated the provision of working hours, of working conditions, of salary arrangements to be made upfront and in agreements. Another interesting thing that we saw is 77% receive their payments in digital form, which we know really presents important opportunities for women's financial inclusion and empowerment. And in our study, they tend to be paid above industry average for non-digital care work. It should be noted as well, just looking across that kind of spectrum as well of the 5 Rs that we've been hearing about all day, most of them are not registered in any trade union or professional organization. Okay, last thing I'll share, cognizant of time as well, is I just want to share by ending with a few of our kind of key policy findings and recommendations, which form the bulk of our report. So really in all 4 of the countries that we looked at, a lack of ratification of some of the international labor standards challenges the extent that these workers, care workers, domestic workers are included in that, are protected by national labor law and access decent working conditions. So they're often excluded from social protection regardless of whether they contribute to digital economy or non-care economy. And the real finding here that we see is that the emergence of digitally enabled care enterprises and workers joining this workforce have outpaced the development of adequate regulatory and legal frameworks for assuring their decent work. So we really see a lot of these workers falling through the cracks of both international labor standards and national policy, as the regulatory developments really treat domestic workers and platform workers separately and as mutually exclusive cohorts of workers. So what we're really going to need to see in the future is that intersection, which is complex, but which we will need to see that intersection of policy looking at care and digital economy coming together. And just very quickly, some of our specific recommendations on policy are to ratify international labor standards, to extend coverage of national policy and regulations, to include domestic workers, and introduce gender responsive policy making so that we're including the voices of domestic workers, of digitally enabled care workers, and when digital policies are addressed, to include gender elements to consider this. It's extremely important to improve policies and practices specifically for migrant workers, as Reina also just touched upon, as they're often excluded from social protection and face additional vulnerabilities. Other recommendations like incentivizing the enterprises to support government mandates by putting subsidies in place or other tax incentives, formalizing skills and standards recognition to support the professionalization of the care industry. And we've also seen some interesting examples of DECs advocating with governments to include their workers in social protection schemes. So strengthening this is also something that will be key to moving forward. Okay, I could talk longer, but I think I'm already at time. So thank you for giving me this space today, and happy to answer any other questions.
Thank you, Amy. Thank you for sharing these wonderful initiatives, especially how we're exploring partnerships with the private sector and in the digital space as well. On time, I would like to bring up our next speaker. Again, unfortunately, we couldn't have Ms. Jane Sloan here live, but we appreciate her recorded intervention. Her pre-recorded message, which we will now play. Ms. Sloan addresses the intersection of care work, the gig economy, and the digital solutions. So she will shed light on the emerging opportunities and challenges in the care workforce. And I will just ask my team to play the video.
Thanks so much for inviting me to speak at this important convening today. In Asia and the care economy is understudied and undervalued when compared to other regions. There is very little data coordination and investment in care delivery models, despite the region's high demands for care work. In this situation, the Asia Foundation saw an important opportunity to change the dynamic and build momentum toward collaborative action. In talking with partners, donors, and researchers, we organised a Bali economy dialogue to coincide with the G20 in Bali in November last year, with several goals in mind. First, create a forum to elevate issues related to decent care work, dignity of care, and building a care ecosystem. Second, we saw a need to build the knowledge base around care by synthesising key insights, gaps, best practices, and actionable solutions related to the care economy. Third, we wanted to provide a platform where diverse actors could engage in joint learning and develop a roadmap for action on transforming care. And we wanted to identify where new investment was urgently needed. Our partnership with actors across civil society, governments, the private sector, researchers, unions, and movements for justice was crucial in developing a plan of action. The dialogue included over 80 participants representing governments, the private sector, and civil society. In terms of the discussion, well, we covered a lot of ground in a very short space of time. In relation to the gig economy and technology, we recognised the role that women entrepreneurs were playing in the region in creating digital platforms and apps for the provision of childcare and home care services. We heard from the women owners of mobile creches in India and kiddo care in Malaysia that there is rising demand for flexible care support and a need to provide businesses with access to finance to grow and diversify their businesses. We heard too about the role of technology in protecting gig workers and holding employers accountable for decent work standards. The role of government was crucial in providing an enabling environment for investing in such businesses, while also providing the protections needed for gig workers. The private sector's role is critical through investment in care entrepreneurship, including in the gig economy, and gender-smart investing for care. We also created a white paper on the care economy in Asia and the Pacific as a source document for the Bali convening. The white paper was guided by a central policy question, which was, how can governments coordinate and catalyse civil society, private sector, families and households to meet society's care needs and ensure justice for care providers? And you can see here the recommendations from this white paper, which was finalised after the convening. Together with dozens of partners from the Bali Care Economy Dialogue, we developed the Regional Roadmap for Action, which provides our top recommendations to build a resilient care ecosystem in Asia and the Pacific. And as you can see from this slide, there are a wide range of priorities, from increasing investments in care models and in gender care data, to pushing for care to be included on the agendas of regional and global forums, such as India's G20 presidency and the US APEC leadership this year. As a result of the success of the Bali Care Economy Dialogue, Women Deliver asked us to coordinate a pre-conference on the care economy this month in Kigali in Rwanda. Our focus was on strengthening care policies, delivery systems, and movements for care justice. We also focused on building on the regional roadmap for the care economy to create a global roadmap for the care economy. This roadmap includes a focus on the creation of intersectional care policies and increased investment in promising care models for childcare and long-term care. At the Asia Foundation, we've been focusing on digital strategies and solutions to care economy issues and opportunities. For example, in Vietnam, we've invested in blockchain technology as a means for protecting workers in the gig economy from exploitation, while also providing them with a verifiable record of employment and earnings. This technology makes it possible for workers to open bank accounts, enrol children in school, and apply for urban residence. The Asia Foundation collaborated with Infinity Blockchain Labs to pilot a blockchain platform that creates digital personal identities for domestic workers and connects them with potential clients. This pilot also built a rating system for service providers and clients. We're also focusing on investment in promising care delivery models. For instance, we're working with Kiddo Care in Malaysia to explore adapting their childcare app to long-term care, focused on elder care and disability care. Currently, they provide vetted babysitters and childcare workers to those booking on their app. We also recognise the importance of amplifying effective approaches, so we're supporting the founder of Love Care in Indonesia to speak about this home care app at APEC in Seattle next month. This woman-owned business provides vetted care workers to provide in-home care to families needing it. And we've also invited the founder of Kiddo Care to APEC to promote greater investment in these digital platforms. There is a lack of investment in care delivery models, especially in the gig economy. We need something like a dedicated care fund to invest in testing and scaling promising approaches. We recognise the need for a mix of models and donor funding to invest in these approaches so that they can be adapted and scaled across countries and communities. With the care gig economy, it's also crucial for governments to recognise and implement labour protections for gig workers and to adapt policy making for care platform models. So it's a generational commitment that we're talking about for care justice. National strategies and investment is important, and regional collaboration is essential. Thank you so much.
Thanks everybody for listening in. We've just heard 3 different perspectives on how we are working on rights and decent working conditions of paid care workers. I would now like to open the floor for any questions you may have for Rania or for Amy. And if you have any specific questions for Jane Sloan, please feel free to share them as well. We will ensure that she receives them and we can respond to them via email in a post-event package we'll be sending all of you. So I'll give you a minute or 2 if anybody has any questions. We can also take on questions for people who are listening to us online. All right, but I have one other question that I would like to ask both. So thank you for your and Amy's thoughtful interventions on what you've been doing in your fields. I wanted to ask is there anything that you would like to reflect on, from the contributions made by the other panelists? Rania, do you have anything to say on the work that's been done on UN Women? And Amy, if you have anything similar for IDWF? It's just an optional question.
Thank you, Saleha, for that question. Honestly, I found Amy's presentation very, very interesting because I think it corroborated a lot of the findings and the understandings that we have had from our research as well. And secondly, as Amy cites and lights and sheds light on the care infrastructure and the care entrepreneurship perspective, it would be great if we can marry that perspective to the labor rights and decent work conditions so that both of them can be looked at equitably as we think of new solutions for care which are led by women and women businesses, and also labor rights which essentially need to be protected for paid care workers such as domestic workers. That's all I have. Thank you.
Yes, come in, Amy, if you have any questions.
Yes, thank you so much. Thanks for reiterating that, Reina. And there's really, this was a teeny tiny snapshot of the report, and there's really a lot more in there. And really, I think, if anything, I think our reports talk to each other, and a lot of recent work ILO has been doing as well to really reinforce that domestic work is care work. And I think domestic workers are not thought of as care workers, but really domestic work is care work. Yeah, and a lot of our research as well goes to show how much domestic workers also are excluded from a lot of labor legislation, migrant domestic workers even more so, and that when we look at the intersection as well with the digital care economy and workers finding a lot of these works through these intermediaries, that there's even fewer labor protections and that there's really a more urgent need to ensure that labor rights are protected. So we see some of the role that these care entrepreneurs can play, but I think really focusing on the policy and ensuring that we work with policymakers to look at these intersections and look at how we have labor protections to ensure decent work for all of these workers is going to be paramount.
Sounds great. Do we have any questions online? No? All right. Then with that, we would close. Oh, we have one in this room.
Yeah, thank you. My name is Vientiane from Oxfam in Laos. So I just I have a question on we see the working at home, the domestic work is around 14-hour day, right? So in that case, how the policy or how that we should convince the policy maker that how much we need to work for the office. For example, women, right? Women, how 14 hours working at home and how many hours should we work for the office? Mhm. So you have any experience on fighting on that one?
Well, the research that we did focused on just paid care work and work that is done by domestic workers. So the number that I cited, which is a 14 hours, that is actually 14 hours of paid care work done by domestic workers in that context. We haven't looked into, I mean, that's a very interesting dimension. We haven't looked into the unpaid care that is being done by domestic workers in their homes, which also leads to the discussion that domestic workers are not just paid care workers, they're also recipients of care and may actually need the help of the system to reduce the care burden on them. Therefore, this is something that we are exploring, and we would love to see how domestic workers get rights from both contexts, as workers as well as recipients of care.
All right, so if we have no other questions, we can conclude the panel discussion. Thank you, Rania and Amy, for joining us online and sharing your valuable insights. You know, your contributions are actually enrich our understanding of the care workforce and the steps that's been taken for empowering care workers in the region. As we conclude this panel discussion, let us take these learnings forward and drive further progress and policy advancements in this crucial field. Thank you all for listening in and for this important cause. And I will hand it back to the MC.
Thank you for Ms. Sariha Shah and the esteemed panelists to share your values insights. And now we move to the next session, the next panel, the panel 3, the third panel. The topic is from the maternity protection and child care. Guiding the discussion is Mr. Maria Laurenti, an expert in women's and child and children rights and advocate for maternal and child well-being. Please.
Thank you. Hi, very good afternoon to all of us. This is a very critical hour, yeah. So I hope all of us are here, be ready for a discussion that will blow away our mind with inspiration. So Assalamualaikum warahmatullahi wabarakatuh. Mabuhay. Okay, Sabaidi. Ciao bo chiu. I don't know whether it's supposed to be Vietnamese. Maybe it's not correct, yeah. Ciao. Ciao, okay. Sausde, okay. Selamat siang, colleagues from Indonesia and Malaysia. Boa tarde from Timor-Leste. I don't know whether I mentioned it correct. And Swadikap, of course. So yeah, warm greetings to all of you, all the delegations that are here with us in this forum. I feel very honored to be with us. And basically, welcome to the discussion on from maternity protection to childcare. So I would like to just invite directly all the esteemed speakers on this panel. I have 4 very special and important contributors to the discussion. And I'm very lucky because in this session, I have all of them in person. So I believe the discussion will be very, very enlightening. So the first speaker that I will invite is Ms. Vanti Tuha. Ms. Tuha, please come forward. She is currently Social Protection Programs Coordinator at Asia Monitor Resource Center, a non-governmental organization focusing on Asian labor concerns, supporting democratic and independent labor movement in Asia, promoting the respect of labor rights, gender equality, and active workers' participation in work-related issues. Please give her a round of applause. You can have your seat. I also would like to invite Ms. Dam Tivan Toa. Ms. Toa, Excellency, please come forward to the stage. Ms. Toa has served as the Director General of the Policy and Legal Department at the Vietnam Women's Union since 2021. And in her current role, she is responsible for promoting gender equality by integrating it into the development, monitoring, and providing critical social dialogues on laws and policies related to women, children, and gender equality. Please give her a round of applause. Thank you for being with us. The special speaker, Dr. Ninpaseth Sayafonasi, is a distinguished expert in the field of regional development strategy hailing from Vientiane, Laos, and she holds, hello, please come and join us. She holds the role as the Director General of the Department of Women in Development at the Laos Women's Union. And she has held various leadership roles, and her expertise includes gender mainstreaming, international cooperation, and research on critical issues such as migration, domestic violence, and women empowerment. And I think we have one, last but not least, one of the speakers that come from the same country as mine, but not Indonesian. Please come and welcome Mr. Amjad from World Bank. He is a senior social development specialist at the World Bank, where he oversees programs promoting poverty reduction, gender equality, and social inclusion, and currently based in Indonesia, in Jakarta, and he leads policy dialogue, research, and interagency partnership on the care economy and community-driven development. So I believe we are going to have a very rich conversations because of these very special and expert speakers with us here. Let me just start the conversation by giving you a bit of context. I want to share my own story because being in this session as a moderator really close at my heart, because exactly last year at this time I was pregnant with 8 months with a baby was with me, and then I also got COVID at that time. So it was a very difficult time, and I got the support system well because my husband was there to really look after me, and at the same time he had to look after my 7-year-old daughter. And finally I delivered the baby a month after that, and then now he is going to be 1 year old next month. So maternity leave was then started after I delivered the baby. For 6 months I was away. And even though it was a big responsibility that was given by Oxfam to me as a country director, I was feeling very secure to be at home and be present with the family, with the children, because I believe to be able for me to be a caregiver at home with the baby, I felt the whole office was the caregiver for me. Because the workplace itself gave me reassurance that I could take leave and be present with the family. And it really was an enabling, environment, and I felt very supported. And at the same time, going back to the reflection that I had when I was pregnant and got COVID, I think it was really good, because then to be able to have safe delivery and recovery and everything, it really required a lot from the reliable health services and reliable family, but also health, care services that should be provided for working women or pregnant women or breastfeeding women. So with that, I want to say that I felt it was a luxury, because of course not not many of women in ASEAN would feel that kind of, benefit. And this discussion this afternoon, I think, will be very critical for all of us to look at how can we improve, and create better, securing, safe environment for woman that is pregnant, is going to deliver the baby, so maternity protection, and also after giving birth, it's all about care work. So yeah, robust maternity protection policy are really necessary to safeguard the rights and the well-being of working mothers. It can be provided in the format of paid maternity leave, job security, access to breastfeeding facilities, and they are just a few that we could actually provide. So I think without further ado, I would like to invite the first speaker, Ms. Tuha, that she will provide us with some inspiration from the study that is ongoing by her organization, and from that we can all learn together. Over to
Thank you, Maria. Maria is really a lucky case and wonderful case of maternity leave, maternity protection. But I will tell you another story. Sorry.
It's okay.
Okay. I test this one first. Not work. Okay. Oh, okay. Okay, good. Yeah. Okay. So, Excellency, ladies and gentlemen, it's my honor to be here in this very important workshop to share with you initial findings of our networks research on maternity protection in agri-food sector in 5 countries: Indonesia, Malaysia, Philippines, Thailand, and Vietnam. Okay, Maria always say everyone needs maternity protection, right? So I don't need to talk about that. Okay, what is the reality? So in ASEAN, the maternity protection policies are various in terms of duration of leave, amount of benefits, source of funding, and maternity cash benefits only available for workers working in the formal setting. While the whole picture of ASEAN, 80% of working population is in informal employment environment. And if informal women worker included in maternity benefits, the problem for them now is accessibility. And paternity leave is very, very low or absent, like a Cambodia case. And on the top of this, privatizations of basic social services. Here you can see that Southeast Asia is the second lowest coverage in Asia. Only 33% coverage. It means that 33% of population are covered with at least one maternity, the social protection benefits. And workers are discriminated because of their gender, women or men, different, or their citizenship, local or migrant, employment status, formal or informal. And here you can see that the social protection expenditure, excluding healthcare, is too low to be effective. Talking about ASEAN, so we can have a lot of margin for development. So what is the reality in practice? And also impact of policy, healthcare, and other basic needs. I just point out 2 points. One is a higher and higher pocket payment by people to basic social services, including healthcare and education for children. And also very difficult to access to mother and child clinics or hospital in remote area, mountainous area. And in employment, you can say women, they do more care work less income, and less employment opportunity. As a woman, it's almost impossible to get employment if she's pregnant. Migrant workers are not allowed to be pregnant and give birth. And mothers with newborn baby have to come back to work very soon, just 1 month after delivery, or in another case, they have to stay 1 year to take care of children without income, totally depend on husband income and very vulnerable to gender-based violence. And about working conditions, we see feminization of certain tasks, like a sewing, like apply pesticide in agri sector, that where they provide low pays, more dangerous working conditions, more insecure employment, and less protection. And single mother have to bring their child to the working place. For example, to the markets as a case of street vendors. Or they leave the children with their grandparents at home when they work. And they don't have any voice. And here just example, you already talk a lot from the morning, but like a woman have to do 3 times bigger unpaid care work compared to men. And the mothers with the young children aged from 0 to 5 years old, they have a lowest employment opportunity. And here just example which I take from the Farm Research 2020 is a woman in Cambodia that she have to bring with her little girl when she work as a tuk-tuk driver at night time. And way forward. So what can be done? Of course, you talk a lot, and yeah, from the perspective of a network of the social protection network in ASEAN, and especially here in Southeast Asia, I would like to say something. First thing, universality is possible. Maternity protection for all is possible. Why that? We can see strong commitment from ASEAN towards universal maternity protection. And you can see in ASEAN guideline on gender mainstreaming. And also we can see the newly developed declaration toward relating to migrant worker that includes migrant worker with social protection in both sending and receiving country. And some good example of expansion in country level. So like inclusive informal worker in some maternity protection leave, right? In leave, like in Philippines and in Laos. Yeah, we don't talk about the reality implementation yet. Just talk about policy. That's already good initiative. And Vietnam, we add up maternity leave with benefit to voluntary social insurance scheme soon, end of this year. And we also have a good example from Singapore. All working fathers enjoy 2 weeks of paternity leave. So that including informal worker. And also another recommendation that we need to increase maternity leave and paternity leave and level benefits. We already have a good practice. For example, Vietnam and Singapore, they provide 6 months and 4 months of maternity leave. And Malaysia and also Thailand, they try to expand the maternity leave toward the ILO minimum standard. And also Cambodia try to increase maternity leave cash benefit to 120% of the previous earning. And how to do it? Here in fact that we call for no more targeting methodology. Instead, is universality approach. And here you can talk about universal child benefits and other important schemes, including family benefits, for example. And in the newly developed book of the development pathway, they introduce an affordable and feasible pathway to universal social security. For example, very simple example that like a Philippine current existing Pantawid program with the same amount of funding, they can fund universal child care, a child benefit, sorry. And of course, this is an intersectional approach. And next to maternity protection, we need supporting policy. For example, living wage, living income. So we need country to increase minimum wage and provide labor market promotion policy, like loans with low interest rates for very micro or small entrepreneurs, for example. And another one is transformative public services. Why this one? Because it's, we say about that, because currently, with the privatization and austerity measures, the public sector becomes smaller and smaller, weaker and weaker. So we need an opposite way to do it. So we need more government investment in public services, including job creation, and make necessary public services available, accessible, qualified, and free to all. Of course, it's a long journey, but we need it. We need it. And another one, we need more social dialogue. In terms of social protection, we really would like to have a channel for regular dialogue, updates, discussion on social protection between ASEAN and civil society. And for my network, when our research completed, we really would like to have one sharing and discussion workshop with relevant ASEAN body and when we finish our research. So thank you very much for listening.
Thank you, Ms. Duha. I like the idea that no more targeting, yeah? Just go for the universal coverage. So it's really good and very inspiring. Let me just invite the second speaker, Ms. Toa, Your Excellency, for you to share with us, the policy strides that made in maternity protection and childcare that has pushed towards until today. The floor is yours.
Good afternoon to everyone. Yes, I'm very happy to be here to share experience about the Vietnam Women Union and learn some good practice from the other country. And I want to introduce my organization. Vietnam Women Union, established in 1930, is social political in Vietnam, and we and we partner with the government for the advocacy to promote gender equality in general, especially in the social protection, to realize the right to social security for women, including the maternity protection. Vietnam Women Union has developed the evidence-based knowledge to highlight the gender gap challenges in social security system, develop the policy option to address the gender gap, and organize dialogue with the government and the other stakeholders to advocate for changes, including communication with the public and all stakeholders. And come back to the question, Vietnam has 100 million and the face aging in the fast in the world, one country, and Vietnam has good practice in monetary protection, as has mentioned about this. Recently, the government committed to reform a social protection system towards individual coverage and ensure no one is left behind. So my organization conducts the research with the ILO about the gender gaps in social protection and have reports. The reports show that less than 40% of Vietnamese women with newborn has maternity leave in Vietnam in 2021. The problem with the maternity protection system in Vietnam is a big difference between different groups of women, depend on their labor market status, informal and formal sector. Women who are covered by the compulsory social insurance scheme enjoy quite generous minority protection, 6-month paid minority leave, 100% replace rate. Conversely, women who are not covered by the mandatory scheme include informal workers. The main challenge is to extend coverage to the large population of women who currently have no access to any minority protection in Vietnam. Yes. So my organization in Vietnam, the strategy for extend minority protection to informal economy workers are to comply the extension of social insurance scheme with finance through contribution and non-contribution cash transfer scheme which are put in place for women not covered under social insurance. Yes, and I think multi-types minority benefits would make minority protection a right for all women in Vietnam, regardless of their employment status. Yes, that means the try and the women have a better life. Yes, thank you.
Thank you, Ms. Toa. It's really good to hear that the policy is really set up in a way that it is holistic to also take into account the informal sector workers and making sure that they also get access to the social insurance scheme. We would like to also learn from the policy and intervention in this area from Laos. So I would like to invite Dr. Nin Pasoth, Your Excellency, to share your experience and also practices and policies in Laos. The floor is yours.
Thank you very much. Hello. Good afternoon. Maybe you feel sleepy because after we have lunch, right? Thank you very much, dear moderator. And I do agree with the 2 points of our presentation that just share with us is really good. So far we know each other, but sometimes in the subjects that talking about the care work and children is very hard too. So our leader often say that development can never happen if the woman cannot participate or if the woman was not in the process of the development. This is on the times that we do remember. The government of Laos has played very crucial and very intentions in terms of bringing on the better livelihood of the Lao people, especially for the women and children in the family. And maybe you remember that this morning I also shared with you a lot about the experiences of Laos. We have a really good policy. We have a really good legislations and program of actions, but we still have a lot of the challenges. For instance, we know in Laos, we also have a very specific, how do we call the action, maternal plant actions of the mother and child or children. So we are starting from 2021 to 2025. This is on the objectives of this is encourage the mother and child to be the better, because we have the policy of the public health, we have the national policy, we have the legislation, we have the law, we have a lot of things that we have the many legislation and laws relating to the mother and child in my country. If you have the opportunity to go to visit and you just key the word mother and child policy in Laos, you will show on the information about that. So I would like to share with you here, but the harm is really constrained. My friend said only 5 minutes, sister, you have on hand. So 5 minutes is 5 minutes. So I'm talking about this. Lao Women Union is, we are similar to the Vietnam Women's Union. Because the background of our country, we are socialism. We know never and ever forget about that. We could not form ourselves as the public Ministry of Women of Laos or Ministry of Women of Vietnam, but we are the Lao Women's Union. It means that we are also the Ministry of Women, because all the facilities are come from the government. So me are the DG ranks, and she, my friend, Tihua here, also the DG rank. It means I come from the government. And it allows the challenges that we are facing right now is that, you know, the women in Laos are working more than men, about 84% is as a household work. And we do have the opportunity to support, and we do, wait, I miss this, a lot of the paper. I open this back. So it allows we have the, how to say, allow the informal worker wake up more than 84% is compared with men. The statistics show in 2020, and 43% of women are engaged with SMEs and small business and the household business. And of course, the majority of women are limited knowledge, capacity building, and experiences integrating the how to protect them child and children, because it's sometimes the women are working at home, and based on the law of the Lao women, the law on the women and development law, especially that we have a specific article and states that in Lao PDR, we are focusing on 4 areas of development of women. One, we're talking about the emotions. And second, we're talking about education. First is we're talking about the vocational trainings. And the last one is income generations. So women outside home or in home are the same, because we are the respecting the law. So in these challenges, talking about the gender role in care work and social unequality, the women still impacts a lot of issue and burdenness, especially when the incentive and working in home, just waiting for some things or contribution from the family members only. But sometimes the women are lucky if they are come from the really good background of the family. But sometimes when we look at the women are really poor, it's really hard and more harder for her to survive and take care of her children and family members over there. It allows women take 5 times more than men to work at home. This morning we heard that what country women are working hard more than 8 times. Oh no, Mondilete, where is she? Is beautiful girl today. I love you, where is she now? Oh yes. It's from the Philippines that we learned that is some the surveys show that women are working really hard more than that. It's a challenge, right? So if you women are working really hard, it means that she doesn't have time, she doesn't have the opportunity to obtain more educations or just say hello to neighbors or friends or whatever. And it's just very difficult that we could not stop on that. Why? Sometimes some locals, some provinces, some villages, they have the, how to say, acceptable role. And they have there to be the, sometimes they could not present themselves singly, but independency with family members or husband or son or whatever. This is a big barrier, you know. And I showed, next slide, please. Here therefore allows that we have a lot of challenges, as you know that it's not easy to solve everything. Why does Love Women Union has a lot of the projects or programs? Then on the projects and on the programs that we are doing now and connecting with the development donors that into improve the lifestyle and the economic status of women in the rural and in urban area. As you know, they allows the women engaged with the agriculture more than 85%. And the owner of the farmers and SMEs, and also not only that, but also look at the life of the poverty, women also are very poor too. Therefore, we have a lot of challenge. Next slide. And come back to may I share with you a really good experiences in terms of doing we try to pilot the projects. It's really interesting that we are providing, we are calling these projects at parenting education programs. And in the blank is we call love and care for every child. So we are working with the UN agency, especially with the UNICEF in terms of the support of women and families members. And we are focusing in 3 pillars. One, we're talking about the care, maternal leave, sanitation, and etc. And second thing is that we call the protection from the violence, from the violence against women, against the children, and another things from the social abuses and many things that. And the last one is we call the communication. Communication is maybe you are very familiar with social behavior change, because communication can communicate with you, and many things can be happen if you have a really good communication with the family members. Therefore, this program we are running and piloting in the 2 provinces and 4 districts of Lao PDR, and we are covering more than 252 villages, and we have more than 1,427 volunteers who are working with us in terms of doing that. So next slide, please. And maybe you know the why, what, when. Because all the thing that we are talking about this is about the women life, about how to provide a really good opportunity on the families member under leadership, under handover of under shoulder of the women, right? Therefore, here we have to teach them to provide a really good significantly to the families members to look after. Not, I know the time is we finish. Yeah. There's my neighbor say I can take his time. Yeah, volunteer. So in this program, we do not work alone. We do not work alone. This one I would like to share with you. Next slide. We have to work with the many ministries in this country. For instance, we have the Ministry of Public Health to be our steering committee network, Ministry of Home Affairs, and we have the Ministry of the Social Welfare. We have the elderly organization. We have the Ministry of Education. We have the Ministry of Youth Union, not Ministry, but Youth Union. And we have the Lao Front. Lao Front is Elderly Union. In Laos, maybe you know that in Laos, the organization able to work in the village, only 3 organizations. One is Lao Women Union, second is Elderly Union, and the third one is the Youth Union only. So, and why do we work with this? Next slide, please. Next. Because in our program, we are focusing in the 3 pillars. Therefore, in here that we try to provide a really good system. For instance, it allows when deliver the birth, we deliver the baby, majority of the people or mothers, they recognize that I deliver the baby already, but okay, fine, my baby is okay to be the Lao citizen. But sometimes it's not like that. In the future, you need to have the birth legislation. Birth legislation you can do only you go to the district office and through the Ministry of Home Affairs only. But the certificate from the hospital is not the birth legislation. It's a certificate of you keep the birth in the hospital only, but not birth legislation. It's absolutely differently. So next slide. So here I would like to share with you the public that we do have. We have more than 10 posters and talking about the initiative of the family that support to look after the baby, help each other. We try to narrow down the gender barrier. We try to support the key information talking about how adults and husband can help his friends or family member to look after the children. We have 5 videos. We have more than, 6 books. And then we also provide a really good IT in terms of following up the social behavior change of the people. And finally, why do we have this project? We try to have about 20 indicators. Next slide, please. Those 20 indicator is the concern about the next, please. So it's just show the picture, no need, pass. Yeah. This is very important because I would like to show and share with our sister, ASEAN sister here, allows me very successfully piloting this activity with the UNICEF, and we try to use the suggestions of the data of the indicators that Ministry of Public Health and the National Assembly of Laos that point it out to show the status of women and family to improve or improve or not improve. If you see the data or indicators, for instance, hand washing, no, it's a birth legislation over there, sanitation, nutrition, safe birth, and immunizations, and many things that maybe you can have my slide to look after that. And may I also play attention all of you to look at the number 19. Number 19 is we talk about we encourage all the family to have money, save money. So if the woman doesn't have income generation, they don't have, if she doesn't have the sources to earn income, how do she save the money? But in our program, we try to combine all the information when we go to the villages and working with the communities. We try to do orientation that this is very important for your life and for your family. If you are very poor, you should think about this one. And therefore, we have the program really good in terms of economic empowerment. That is, we'll show you next step what we're gonna to do. This afternoon, we also hear from the representative from the ESCAP, UN ESCAP, that if you have a really good program, that UN ESCAP willing to access that. Okay, may I show my next slide and the last slide? Yes. This is really important. Sometimes the paper doesn't support. So after this workshop, we will do a really active work, but I don't know how source that we will find out. Mikhail, please help Lao PDR, okay? And then you just point it out. And other development donors here existing, especially the World Bank, can help us, why not? And we do have the action lectures on the care work at Oxfam, of course. And we have the care economic piloting project in some provinces. And we will focus on advancing the gender action learning system methodology in target areas. We will amendment of the law on women in development and protection. And then the last one is enhancing IEC material and publications in about care work. But I don't know yet, but please help us. And may I play and may I ask you to attention on number 4, because this is a really good opportunity for us, La Women Union now, to amendment of the law on women in development and protection. We have full right to do whatever. We are willing to receive any comments and suggestions from all ASEAN in terms of integrate on key messages and information in this law. This law will be sent to the National Assembly maybe next year to adopt. Yeah, next year. But we do have now this law we already adopted. Is what adopted in 2004. Yeah, how do you know really well? 2004, but now is a time to review. Therefore, we have the opportunity to do it. So thank you very much, my dear. Thank you very much.
A round of applause for your excellency. Thank you so much for sharing very good example. It's just true, yeah, that for one piloting project, it requires collaboration across organization and ministry to make that happen. And this is why we invite World Bank today with us to really also dig and delve more in conversation to connect how World Bank role in the sector, and particularly also connect with ASEAN, and also to the support or working collaboration with countries in framing and also approaching maternity protection and childcare. Over to you, Mr. Amjad.
Okay, thank you so much, and good afternoon, everybody. I realize I'm between lunch and tea break, so I promise not to take too much time. Maybe I can, if you would indulge me, maybe I can play an integrative role. It's been great to hear about the different examples that other speakers have provided and the discussion from the morning, and sort of try to connect the dots and situate the care discussions within the broader institutional arrangements, and then conclude with what the bank is doing in each of these areas. So as a development organization, of course, our starting point is always to identify the development benefits of investing in care. And there has been sufficient evidence over the years by women's organizations, feminist economists, which is now becoming more mainstream and accepted by organizations like the World Bank as well, showing the human development benefits of investing in care, benefits in terms of employment, job creation, and benefits on economic growth, typically through increased female labor force participation and also creation of supplemental sectors that are currently part of the black market or or the informal economy. So with these benefits in mind, still many countries focus on care as a service provision agenda. And there are, of course, many great reasons to do so. And we've been discussing since the morning some of the gaps in terms of access, some of the gaps in terms of the availability of services, the quality of the services, flexibility to cater to family needs, whether it's childcare or elderly care, making sure that the services are available at times and life stages where families need them most. Many programs still struggle with addressing these issues. But again, taking a step back, these problems are sort of symptoms or manifestations of more structural institutional gaps and regulatory gaps that prevent from services from becoming more accessible, more affordable, better quality. And I would just like to maybe refer to a few of these institutional gaps. We know, for example, in the world of labor and labor laws, there is much to be desired in terms of providing maternity leave, parental leave, but also supplementary labor laws and policies to prevent sort of anti-discriminatory roles, equal opportunity laws. A funny but sad anecdote was from last year in Indonesia, when the maternity leave was increased by the government from 3 months to 6 months. some women's organizations actually expressed deep concern that this policy change would prevent them from getting hired in the first place. So a policy that's supposed to actually expand care benefits and improve the lives of families and provide benefits for women to participate in the labor force may actually result in backlash, and that was actually one of the main points that many women's organizations made. So laws about maternity, paternity, parental leave policies, etc., will need to be complemented with other laws and policies to make sure that there are sufficient protections against these types of backlash. Of course, social protection schemes, there's a lot to do on that front in terms of providing protection and decent working conditions for care workers, expanding access to care services through existing programs. And I guess in the spirit of this conference and the SDGs on leaving nobody behind, of course, expanding the scope of social protection services to reach those who are most in need, living in rural, remote areas, underserved areas. These are sort of the usual suspects, I guess, when it comes to care economy discussions. But I would also argue that there's a lot of room for interventions in other areas as well, such as the business ecosystem. In many countries, for care services to be provided by the private sector or by NGOs or civil society organizations, there are many licensing, accreditation, and heavy sort of red tape requirements in place that effectively serve as entry barriers for greater care provision by non-state actors as well. And of course, if we were to remove these obstacles for private care providers to enter this space, we would also need to make sure that there is a skilled, capable care workforce, which involves basically formalizing the informal care workforce prevalent in many countries who, in many cases, don't have decent working conditions. So maybe since I only have a minute left, maybe I will quickly turn to what the World Bank is doing in each of these areas with very quick examples from the ASEAN countries as well. So the first thing we do as a development organization is, of course, we collect and publish lots of data. And our data sources have over time become more and more sensitive to care issues, whether it's aging, whether it's childcare, but I would just like to highlight two new initiatives that many of you, I think, would benefit from. Our Women, Business and the Law publication that looks at monitors legislation in all the countries in the world, has recently adopted a childcare pilot. And for many countries, including several ASEAN countries, we now have information tracking the different childcare policies and laws that have been enacted over time. And some recent research also published by the World Bank actually tracks these legislations and links them to significant increases in female labor force participation. I think 4 or 5 years after the enactment of childcare related laws, there is on average 4 or 5 percentage point increase in female labor force participation. Another initiative that's ongoing right now is for our living standards and measurement surveys. These are household surveys that we implement in almost every country in the world. They are now piloting time use modules, more compact time use modules, to make time use data more available across the world. Because as it was mentioned earlier, first step toward moving towards sustainable care arrangement is, of course, recognizing, and it's hard to recognize without having the data in place. So we are broadening the availability of data across countries. The second area in which we're working is testing innovative pilots, different service delivery modalities. And I would like to highlight a couple of examples that we have, one in Cambodia and one in Indonesia that's coming up. In Cambodia, we have a pilot operation that we're implementing together with a civil society organization that's targeting women who are working in manufacturing sector, many of whom are migrant and face the difficult choice of leaving their kids behind in the care of other family members, typically grandparents who are in need of care themselves. And this pilot provides on-site in the factories where migrant women work, on-site facilities and care services for children to accompany their mothers and associated programs with that. We will have in Indonesia soon a new program that will be testing a community-based childcare provision model, which will build on the existing government childcare center network to basically test different civil society and community organized childcare services. And we have several other projects coming up in the region. And finally, on the regulatory systems, we have had some projects in programs in this region, most notably in Vietnam, where we helped the government with the revision of the labor law that included enhanced maternity and parental leave type of benefits. So just to sum up, I think one issue that many countries and ASEAN countries are no exception to this is sort of connecting these dots from data to service provision issues and linking them back to the ecosystem and the institutional problems that need to be addressed, because there are structural problems that are difficult to address through individual social protection schemes, individual service delivery programs, without really addressing these institutional underpinnings of failure. And we are increasingly cognizant of that, and many of our programming is trying to bring service delivery enhancements together with institutional changes in laws, policies, regulations. So I'll stop here. Thank you so much.
Thank you, Amjad. Thank you so much. A round of applause. I couldn't agree more to say that, supplemental policies are really required to support the care policy itself to really encounter other externalities that are actually caused by the policy. So it is really necessary to really look at this at a holistic perspective. So I think, according to my timekeeping, actually we already passed the whole time allocated for this session. Do we still have time for question and answer? No? Oh, okay. I'm really sorry. But I think all of us can enjoy the tea break and catching up with all the speakers in this session. If you would like to have more information or have burning questions or anything related to the maternity protection and childcare. But I just want to close the session by concluding and saying that it is really clear that collaboration among stakeholders to have care economy works for the benefit of all are actually imperative. And we hope that policy making processes are going to listen to the voices and the representations of care workers and care users, particularly when it comes to maternity protection and childcare. Thank you so much for the session, and thank you for all the sharing that have been given by the speakers. With this, enjoy your tea break, and I will pass it on to the MC.
Yes, okay. Thank you, Maria, and the esteemed panelists for your enlightening speak. And now, I think that we have a short break now. After 10 minutes, we will come back for 10 minutes. Yes, we will come back. Please enjoy. Hello, good afternoon, everyone. Now we will continue to the last panel, no? The final panel for today. So please. Hello, could you please turn on your seat? We will start now. So can you bring the coffee or tea bag or inside the room? We will start our session. I hope you enjoy your break. And now we will start to the panel discussion for the final panel for today. And the topic for this panel today is data and evidence building on care. Moderating this discussion is Mr. Schubert Sirsia, a Lee Move researcher and advocate for data-driven policy making. Let's explore the significance of the evidence-based approach to the care economy. Please, the floor is yours.
Hello. Thank you, Madam Facilitator. Good afternoon, everyone. So the good news is this is the last session. So after this session, we will go back to our hotel rooms and maybe just to tease you with what is awaiting for us after that. I heard that the organizers has prepared a sumptuous welcome dinner for everyone. And I heard also, this is at the Tom Naklaw restaurant, and I also heard from somewhere that we will experience an amazing array of Lao cuisine from the northern part of the province to the southern part, which is a very rare experience. So I hope that's good enough to perk you up for this last session. We have 45 minutes. Everybody's smiling. Okay, so I take that as a good sign. So we have the previous panels. We discussed about there is a sharing about the policy landscapes, the progress we have made so far, and then in the third panel we tried to deep dive into a specific area of concern, which is maternity and child protection. And I would like to assume, and I'm pretty confident to say that all of us here agree that there is a need, the need for a care economy, and that we should do more something about it, right? I think everyone agrees on that. Perhaps the next question then is, what do we need to do then? What is the magnitude of work that awaits us? And to further understand that, we will need numbers to guide us. So this is all about, this is what the last session is all about. It's about the data and evidence building on care. So these are important considerations for us to understand what needs to be done and to inform our work plans. Understanding the magnitude of care work is essential for policy development and resource allocation. It helps policymakers, like most of you are, identify crucial areas where support is needed. It helps us to identify gaps and challenges and enable governments and organizations to refine strategies and improve the quality of care services. by collecting and analyzing data on unpaid and paid care work in the ASEAN, we can promote informed decision-making, equitable resource allocation, and ultimately enhance the well-being of individuals and families across the region. So to help us understand the need for securing quality data to inform our decision-making process, we have invited distinguished colleagues, friends and colleagues from different sectors to share with us their insights and perspectives on data and evidence building on care. I would like to invite them. We have a distinguished representative from the Philippine Commission on Women, from, sorry, I have to look into my notes just to make sure that, from the Institute of Development Studies at the University of Sussex, from Oxfam, of course, and from the EURO. EURO means International Women's Rights Action Watch in the Asia Pacific. I will introduce them later when it's their turn to share their experiences. So if I may call our distinguished colleagues on stage, please. Excellency, here. We will be joined, three will be physically here while another one will be joining us virtually. Okay. So without much ado, we can start the discussion. And if I may first introduce to you the first panelist, Her Excellency, sorry, Her Excellency Deputy Executive Director of the Philippine Commission on Women, Christine Balmes. Madam,
Hello.
yeah?
Yeah.
So just before I give the floor to you, Deputy Director Balmes has a distinguished and long experience in government service, and she is particularly noted for championing particular advocacies, especially on promoting women's rights and addressing unpaid care and domestic work. And Deputy Director, can you, sorry for my notes. You have done amazing work in terms of gathering evidence to inform the policies in the Philippines. And perhaps if we can invite you to share your insights on those data initiatives that is being undertaken, on the partnerships required to do so, and some best practices that colleagues from other ASEAN member states can perhaps refer to. You have the floor, Madam.
Yes, thank you, Schubert. Actually, I would like to thank the previous panelists to have shared a lot of data about the Philippines. So I will not repeat most of them. Like what you said earlier, the data we collect, we use for policies, to make policies. But in the Philippines, aside from making policies, we use the data that we collect in implementing our gender budgeting system. So the data that we have, we share to different government agencies and make sure that they identify the gender issues that are relevant to their mandates, to the mandates of their agencies. So I just would like to share some of the partnerships we've had with different development partners and other stakeholders in gathering data relevant to the care economy. So first, as shared earlier by Leia, together with Oxfam and UN Women, the Philippine Commission on Women conducted the 2021 National Household Care Survey, and results of which were already showed that disproportionately burdened women and girls historically has only been further exacerbated by the COVID-19 pandemic due to the imposition of measures such as the lockdowns and community quarantines. And this led women and girls to carrying out domestic tasks such as supervising and homeschooling their children or younger siblings and caring for the ill or elderly family. So in general, as Leah stated earlier, the 2021 NHCS showed that women spent up to 13 hours a day on care work activities in comparison to 8 hours a day for men in the midst of the pandemic. Also, during the pandemic, we also did a survey for the Great Women Project, or what we call the Women Economic Empowerment Project, which is funded by the Government of Canada. And this survey on women micro-entrepreneurs surfaced the significance of access to child support services while women micro-entrepreneurs are working or are in training can be a great help to them. So the establishment of accessible, affordable, and dependable child minding and daycare services means that they no longer have to feel like they have to choose between establishing a business as a source of income and ensuring that their children are safe and cared for. So moreover, we conducted a stakeholders consultation on strengthening economic support to rural women, which involved representatives from national government agencies, CSOs, and the private sector. And this is in partnership with the National Anti-Poverty Commission, which affirmed that there is a need to strengthen awareness raising and appreciation on the value and importance of unpaid care and domestic work, as the issue of multiple work burden significantly affects women and girls. And in recent years, the PCW has taken part in different efforts on regional cooperation in the care economy, such as in contributing to reports developed by the UN ESCAP for ASEAN and the Asia-Pacific region with concrete recommendations to address the care work burden, and also participating in different conferences or dialogues by the Global Alliance for Care, since the Philippines is the first country in Asia to be the member of the Global Alliance for Care. So currently, PCW is also taking the lead role in the ASEAN Gender Mainstreaming Strategic Framework, although this does not directly is not directly relevant to the care economy. The implementation of the AGMSF seeks to elevate attention to gender issues such as unpaid care and domestic work beyond the socio-cultural sector. So I would also like to share, while still currently underway, the Philippine Commission on Women is working on tackling harmonization, population of data on core gender and development indicators, and data sharing across key implementing agencies in the women economic empowerment sector in the Philippines through a data sharing agreement and development of data sharing system.
Thank you, Deputy Director. So that is an excellent example of how we can actually use data to inform decision making. And in the particular case of the Philippines, I think what is resonant for me is it is used for budgeting and gender mainstreaming. If I can further prod you on that, perhaps, because in each country, I presume there is a national statistics office, right? And one of the main challenges actually is the lack of gender segregated data. So in the case of the PCW, is the data generated been also part of the official body of statistics of the national office? And if it is, I'm assuming that you took a lead role, the PCW took a lead role making that happen. If you can kindly share that with us also.
Well, actually, the Philippine Commission on Women sits as the chair of the Interagency Committee on Gender, Children, and Youth Statistics, or the IAC-GCYS, which is one of the subsectors of the Philippine Statistics Agency. So, beginning in 2021, the IAC GCYS proposed the guidelines for the the guidelines for the Philippine Core GAD indicators, which were recommended by the Technical Working Group of the Gender and Children Statistics under the IAC GCYS. So the said list of gender indicators includes, among others, average time spent on unpaid domestic and care work by sex. And moreover, in 2022, the IAC GCYS provided inputs to a draft agency readiness assessment tool so that we can identify agencies who can use the guidelines on establishing and maintaining the statistical online GAD database. Also, just recently, the IAC GCYS reiterated the board resolution of the PSA on enjoining government agencies to promote gender concerns in the generation of their gender statistics. And just recently, the PSA together with the PCW, we shared the results of the 2022 National Demographic Health Survey, and the final result has also been released just last month. So it serves as a vital reference, not only for the PCW, but for all relevant stakeholders in ensuring that initiatives are evidence-based. And taking part in the discussion on policy and program implications during a regional dissemination of the recent NDHS, we were able to highlight that in an examination of earnings of married women, nearly 1 out of 5, or 19%, are not paid for their work. So while no sector or type of employment or industry or commodity is mentioned in the data gathered, we can draw from other reports as well as the annual fact sheet on women and men by the PSA that performing domestic or home-based work and contributing to the family is usually unpaid and primarily performed by women and girls at 11.3% compared to men at 4.7%. So moving forward, I think Leo was there during the committee meeting when this was discussed. The committee plans to include and further substantiate much needed data through the inclusion of rider questions centered on time spent on domestic and care work and actual number of minutes spent on these activities in one round of the labor force survey, which will be held in August. And specifically, these are some of the questions that will be asked on cooking, serving, means and washing dishes or arranging food supplies, washing, ironing, mending of clothing, or household linen, among others. And this will be significant in the formulation of plans and policies on underlying issues on unpaid care and domestic work. And furthermore, the IAC GCYS will work on exploring the possibility of valuing unpaid care and domestic work to estimate its actual contribution to the economy and include additional questions on the frequency and episodes of activity and multiple housework.
So that is official data.
Yes.
Yes, and official data is very important for us who do policy work, right? The footnotes are very important. The data should withstand scrutiny. So that is why it is very important that related data to unpaid care, to care, is also included into the official body of data of each country. Thank you, Deputy Director, and we will get back to you with questions. And in terms of data and evidence generation, we actually have, in Oxfam, we usually work with the research think tanks because we believe the research think tanks have the discipline and they have the competency to initiate research and generate the relevant documents to support our arguments or to support our recommendations. And we are very fortunate that today we have with us Dr. I just want to pronounce your name right, Dr. Dipta Chopra of the Institute for of Development Studies from the University of Sussex. Apologies, Dr. Chopra, for making your we had a very interesting discussion and we covered a lot today. And thank you for your time and accommodation. Dr. Chopra is a renowned feminist social scientist with focus on women's empowerment, gendered politics of policy processes, and the role of women's movements in effecting policy change and countering backlash. So this is a very relevant discussion for us. She's with us now virtually. You can see her in the screen to share with us their insights, their work in the region and with countries on data and evidence building on the field of care. Dr. Chopra, you have the floor, please.
Thank you very much. Can you all of you hear me? Great. I had the pleasure to also look at and hear the previous session panelists, so that was really good. Could I just ask if the room is sharing my slides or I'm doing that?
You can do that, madam.
Okay, let me share screen then. Okay, can you see the presentation? Yes? Okay, great. Thank you so much for inviting me to this amazing forum on care, and I'm so excited to be online, and also equally sad that I'm not there in person. So apologies for that. But I just wanted to start off with with the basic idea of what IDS does and what other research organizations or think tanks can do for care policies more generally. So I think the main thing really is about kind of like looking at research, not just for research sake, but research which is conducted through equitable partnerships and how that knowledge is translated into practice, especially to address complex issues, because we know that just collecting data is not going to help. But also just a word on the type of data. I don't think it's necessary that it has to be numbers only. In fact, we found that policy research requires a very attuned focus on both policy actors, their incentives, so a sort of gendered political economy analysis. What are the resources available to governments in order to address care, so that we can move towards equitable, sustainable societies and better lives for everyone, especially women and children in this particular environment. And I think the main thing that we've done in partnership with the UN ESCAP and our esteemed colleague Shane is in the room with you and will be able to tell you more also about this tomorrow in her presentation. But I just wanted to say that in partnership with ESCAP, what we've done is we've reviewed secondary literature, and where we started from was really thinking about COVID-19 and how that had affected Asia and Pacific. But then we were very quickly moved on to looking at specifically ASEAN, and we were very fortunate to have the ASEAN committee involved in this and looking at how we could actually address unpaid care and domestic work in the ASEAN region. And then going from there, we realized that actually there are so many things that we kind of like assume what the care economy is, how do we address it, what is care, but really needed to kind of put all those definitions and explanations together. So that's how the primer emerged. And these are documents that are freely available on ESCAP's website. We've also looked at specifically building not just a gender differentiated, but also a care sensitive policy framework, which is really important to address both the direct care that women do, but also the indirect care, like the cooking, the cleaning, the collection of firewood and the washing of clothes, etc. And in this, what we've done is we've created this particular. We started actually, with creating this particular framework where and I'm not going to go into any detail in this, and I know it's a very complex diagram, but just to say that the care economy, which included both unpaid care and paid care work, had moderating influences, which led to and differentiated care policy responses, which led to different outcomes. And those three outcomes could be either gender blind outcomes, which we don't want, either gender sensitive outcomes, which are okay, but they're not necessarily responsive to the care needs of women. And therefore, in order to have transformative policies, we really needed to look across a range of policies which recognized care as foundational. And in this, again, like taking a very political economy approach, we thought that it's important to, when we think about building care policy actions, in order to translate that data into action, into policy action, we needed to think about both the core care principles as well as the levers of change. And these are the care principles where, as I said, we need to recognize care as foundational and acknowledge it as a public good, but also look at states as accountable for the guarantor of rights. I know that the previous presentation, we spoke a lot about the family, and the speaker, Her Excellency from Laos, talked about social norms and redistributing care to other family members, including men. But I think there is a very strong evidence base that we do need to also think about other actors in this institutional care diamond, which include the state and the market, so employers, as well as the community. And we also realized, and again, we saw this, already it's coming up in your discussions, how it has to be an intersectional lens. So, urban, rural came up in the last panel. Class differences are really important. Care for women who are disabled or have multiple disadvantages would really be important for these care sensitive and gender differentiated policies. We've heard a little bit about from our earlier speaker, and we've had the pleasure of working with the Philippines Commission of Women, where we really realized that it was a whole of government approach that is necessary. And of course, as this panel, as this event shows, to promote regional collaboration is also really critical. Again, I won't go too much into the policy actions, but to just say that we are proposing that there are 4 main policy category buckets of policy actions, if you may, in which any response to care and the research on care would be good to fall into. So there's care infrastructure, there's care related social protection, there's care services, and also there's employment related care policies. And again, in the previous session we were talking about maternity leave policies, or maybe gender equitable care leaves, etc. And again, in this session, we're talking about data, and I think it's important to collect and have the gender disaggregated data, but we also need care disaggregated data. Who is doing care, under what circumstances, and what are the different intersections? We need to have a legal and regulatory climate, again, something that PCW is working towards very much. Norm change that we heard, Laos is doing very much, and financing of gender responsive budgeting. I've also heard a little bit about the interministerial collaborations, but also more and more we kind of need women in decision making, because we need to hear the experiences, and this is what research is showing us, that we really need to hear the experiences of women. I will just end with this, where basically we again, in partnership with ESCAP, we've done case study reports for both Cambodia and Philippines, and where we are now moving towards is to provide technical and advisory assistance. And again, our Shane will speak much more about the model framework of action that we are developing in partnership with ESCAP. But the main idea is to not just look at the recommendations, but also then really think about how to, how do you recognize care? Is it just through data, or is it actually looking at behavioral change and other things? So capacity building workshops for core ministries for developing national framework of action, and we're very pleased to say that we're doing this with Cambodia to start with, and looking at also co-constructing training and sensitization events, not just for the core ministries, so for example PCW or others, but also for other line ministries. Perhaps it could be the infrastructure ministry or the water ministry. So that's where we are with at this. And I think what is really important to know is that that again, that research is one of is a tool, and we're really keen to partner with the ASEAN countries to really think about country-specific national framework of actions which give priority to any one of those 4 policy categories, looks at what the political economy configuration of things are, and how we really need to bring care to the fore. Thank you so much for your time.
Thank you. Thank you, Dr. Chopra. That was indeed very insightful, and at least from my side, what struck me was, you mentioned about the range of policies. So it's not just any particular data, but it's like the universe. So we need to take that into account, not just to be selective about it. You also mentioned about the intersectionality, because care care is in almost care-related concerns is in almost everything we do, and the whole of government approach. Miguel earlier also mentioned the whole of ASEAN approach, which indicates that there should be a lot of partnership here, a lot of working together, a lot of cooperation. So if I may invite you to focus on the ASEAN region with the expertise of the institute and other research think tanks. If you can kindly share with us your thoughts on how possibly we can work together in the ASEAN. Are there any ongoing partnerships that the institute is having in the region, and what particular arrangements, or how do you see the institute will be able to contribute in building this body of evidence to support our work on care? Thank you. Back to you, Dr. Chopra.
Great, thank you. And I think that this is so yes, existing partnerships are there. We are, as I said, we're working with UNESCAP in partnership with and we've had a partnership agreement with them to work on the developing a national framework of action for Cambodia, and we're hoping that Indonesia will follow, but we really would also like to work in partnership with Laos and with other countries. In fact, in partnership with ADB, we looked at a selection of childcare options and how to bring, and this is something that our colleague from the World Bank also talked about how we can bring these initiatives together, and especially on childcare. We're partnering with we have conducted some research with local consultants, and I think the multi-level partnership is really key, because although it's really important to have a deep dive into each country and each country's context, and I think it's really important to also build a regional collaboration, and we have very successful examples in the Latin American region in order to do that. So at IDS we believe not just in research for research sake, but really research for policy's sake, and to think about joining the dots. We would be very willing to to have more conversations and develop partnerships with the region.
Thank you so much, Dr. Chopra, for your time. We will come back to you if should there be any questions later at the end of the panel discussion. Let's give applause for Dr. Chopra. So, in building the evidence, in gathering data, we need the right tools. And Dr. Chopra already shared some of this, their approach in the Institute. And other non-state stakeholders in the universe of care are also doing their own initiatives, like CSOs, like Oxfam. We would like to believe that we are Oxfam. I'm from Oxfam, by the way. that we are also like lending or contributing to building the body of work on care, and that is perhaps the reason why we were invited. Our first engagement with ASEAN was in October 2019 in Brunei, Darussalam, during the 19th meeting of the ASEAN Committee on Women, when the ASEAN Secretariat has kindly invited us to share our insights on care. And we have with us my colleague, Myra Nerin Bat, who will be sharing some of the tools that we used in supporting evidence-based policy formulation, that data collection and program implementation. Myra?
Thank you so much, Hubert. I'm truly honored today to be representing Oxfam at this prestigious forum and talking about data and evidence building on care. So as we've discussed today, care work needs to be recognized, shared, and invested in now more than ever, given that the progress on SDG 5 is behind target. And COVID-19 on top of that has created additional challenges that could reverse the gains made in gender equality. Data collection is critical for the recognition of unpaid care work in government policy making and priority setting, because what doesn't get measured doesn't get seen. So if we don't measure it, we don't see it. So just to kind of start this conversation, Oxfam's Time to Care report, launched in 2020, calculated that the monetary value of unpaid care work globally for women aged 15 and over is at least $10.8 trillion annually. So that's a very big amount. So the government's responsibility to collect time-use data on unpaid care work is contained within SDG 5, particularly indicator 5.4.1, which requires governments to track the proportion of time spent on unpaid domestic and care work by sex, age, and location. So this commitment has been talked about a couple of times already, and just kind of reiterating the language again here. But why is this not happening? Because it's not that simple. Collecting data on care is very challenging. It is costly. And while we may have consensus, let's say in this room, amongst all of us gender folks, that data is important, when we go to other ministries, it's often not that easy. So it was great to hear about the interagency collaboration, but obviously I'm sure it has been a journey. It took years probably to get other ministries on board. So how do we get to the whole of government approach? How do we build this consensus going forward? So to facilitate this, Oxfam has developed a set of tools targeting different audiences and to serve a set of different purposes. For me, when I look at these tools, these are essentially advocacy tools, and they facilitate the journey towards, let's say, time use surveys, towards improved policies on care. So these tools draw on the work of feminist and development organizations, and some of them are mentioned here, but there are a lot more, of feminist and development economists, as well as a range of civil society and right-based organizations globally. So building on Dr. Chopra's point, equitable partnerships are equally important. Who are we listening to when developing these tools? If you would have listened to the presentations today, for me, for example, IDWF and AMRC's presentations stuck out a bit different from, let's say, how governments perceive care. Because when we do center people and what they think about care and what kind of solutions they would want to table, we end up with very different results and very kind of different decisions. These tools are also inspired by the ILO's 5R framework. I just saw the word rebuild somewhere as well, so I don't know if we'll end up with the 6th one in a few years as well. But yeah, they are based on the framework as well. So I will start with the tools that look at data on how people spend their time. Again, the end journey may be time use service, but these are two tools that can help us move towards that journey. The first tool is the Household Care Survey, which is a quantitative survey tool that generates context-specific evidence on how women, men, and children spend their time, how care is provided, by whom, and the main factors that affect people's responsibilities for unpaid care and domestic work, such as access to care services, infrastructure, and social norms. As Didi Christine mentioned, this exercise has already been undertaken in the Philippines, and now we are planning a similar one with Lao Women Union, hopefully. Now, this tool can help gender ministries advocate with statistical authorities, finance and planning ministries, and encourage national statistical systems to collate, analyze, and report data on time use. Similarly, we also have the rapid care analysis, which is a set of exercises for the rapid participatory assessment of unpaid household work and care for people in communities. It has been used by development agencies to improve the design and outcomes of development programs. So while the household care survey is a quantitative tool, a rapid care analysis is a participatory assessment like a qualitative tool. And it is they're both different because RCA is again qualitative at a smaller scale and project-based, but it helps start a picture. So if there's very little funding, this is just a very quick exercise we can do to start the conversation. While household care survey, like Didi Christine mentioned, it had 2 to 3 partners, so it's a bigger undertaking. Moving on, I will now present 2 tools that look at the role of organizations. It really matters what each of us do and how we operate as well. So firstly, we have the care principles and barometer. The principles have been envisioned to serve as a guideline for organizations and institutions to develop and implement care responsive strategies. This tool really looks inwards and looks at how an organization can improve its structures and ways of working. So for example, if the Lao Women Union wants to improve how it is care responsive as an organization itself, this would be the go-to tool. It would look at, let's say, care policies within the organization, maternity laws that apply within organization to staff, things like that. Similarly, we have the care principles and barometer for IFIs, and this is based on the idea that the architecture of development finance lacks a care perspective, despite very strong commitments to gender equality goals. So this tool looks at care responsiveness in IFIs like EDB and World Bank, and they've been developed as guiding tools to promote, measure, and improve the care responsiveness of all IFI operations. And this tool very quickly looks at 3 levels: corporate, country engagement, and project level. And I think for this audience, the most interesting one is the country engagement level, which looks at how IFIs interact with countries and how this process itself and this engagement can be improved from a care lens. So while we've looked at data, then we've looked at the role of organizations, we will now move on to, well, what do we know about policies and how can we build evidence on policies? We have the Care Policy Scorecard, which is a tool for assessing country progress towards an enabling policy environment on care. It is a practical tool to assess and track the extent to which government policies related to care are adopted, budgeted for, and implemented. We've talked quite a bit about budgeting today, and the extent to which they have a transformative effect on care. It also, one thing that's very interesting for me, it also looks at whether caregivers were consulted in development of the policy. So that's also quite, I mean, there's very little evidence on some of the older policies, but this is also like an interesting take on how we look at whether policies are effective or not. It provides policymakers with evidence and information to make informed decisions on these policies. It can be used both at the national and subnational level, and it measures performance and progress on policies related to unpaid care work, paid care work, and cross-sectoral policy areas. It is intended to use by civil society, government, and academia alike. So the purpose of sharing all of these tools today is that we as Oxfam see ourselves as partners, as allies, sometimes as critical friends for the gender ministry sitting today. And these tools are essentially advocacy tools that can help push for increased data and evidence on care. So not saying that these are the endpoint, but these are really tools that can help lobby with other government ministries. They really do center people in communities. So whether it be in the form of what the toolkit asks, whether it's asking the right set of people, the right set of questions, they do really center the need of caregivers and care recipients. So with that, I present a few concluding thoughts. So like I said, these tools can incrementally be used to drive decision makers to prioritize and invest in research, time use service, and to build a knowledge base and inform advocacy on care work. Apart from driving policy change, just really reiterating why time use surveys are important, they're important for budget allocation related to reduction and redistribution of unpaid care work and the promotion of gender equality. So the way forward that we see is either standalone time use surveys or time use modules as part of labor force service and demographic and health services. And it was really, really heartening to see a move towards this in Vietnam. Further, again, this is ideal, but to reveal intersecting inequalities, data should ideally be disaggregated by age, sex, ethnicity, race, migration status, disability, and income level. Lastly, we need to collectivize and concentrate our efforts to include unpaid work within the production boundaries of the system of national accounts. Because again, like I mentioned, if we don't measure it, it's not seen. So I hope we can move towards that slowly. Thank you.
Thank you, Myra. By the way, Myra is the Regional Gender Justice Policy and Advocacy Manager at Oxfam in Asia. Sorry, I forgot to mention that. So, yeah, it's interesting. So, what interests me most is like the institutional tool, because sometimes it's not just about what we want to change, but it's also about us who wants to make that change, right? Are we practicing what we preach? So that's very interesting. So Myra, you also said that these are already being piloted so far. Are there any feedbacks from the end users?
Yeah, and we're actually improving these as we go along. So for example, we're launching a policy scorecard in Timor-Leste, which is looking at it from a disability lens. So there are different approaches, and again, all of these tools are very customizable. So like I mentioned, the policy scorecard looks at unpaid work, paid work, and then cross-sectoral. So it really gives us a menu of options to customize it. I also know that there was a household care survey in India that really tried to build in some qualitative elements because the quantitative element itself was giving an incomplete picture. So they mixed the RCA and the household care survey. So really this is just, I would say that this is something that all of these tools are very customizable and they can be tweaked according to the needs going forward. Thank you.
Thank you so much for that. So let's give Myra a round of applause. So we talk about tools. There can be a warehouse of tools there somewhere, right? But the question is, are these the right tools? Yeah. So we know there are different segments in our society, and usually we design what are the appropriate tools for them. We have this experience, one of our partners, regional partners in the ASEAN, Weaving Women's Voices in the ASEAN. They developed a feminist economic justice agenda for the ASEAN, which they are now promoting with the ASEAN economic community. And one innovation they did was, because it's challenging. They work in the rural areas. It's challenging to come there with a piece of paper or something and just, collect data from individuals. So they used another approach, telling a story. And we are very fortunate that today we have a colleague from the International Women's Rights Action Watch in the Asia Pacific, a Southern-led international feminist organization working towards the full realization of women's human rights through the lens of the Convention on the Elimination of All Forms of Discrimination Against Women, or CEDAW. And we have with us today Praveen Premnath, who is the Communications Officer of EURO in the Asia Pacific, and he will be sharing with us their very interesting experience in using this particular tool. Their expertise on how storytelling can be used to collect data and evidence. Praveen, you have the floor.
Thank you so much, Shubert. So I think Dr. Deepta sort of set the stage perfectly when she said that we need to hear the experiences of women. So Sorry. As mentioned, Eurasia Pacific is a global South feminist organization working towards the facilitation and implementation of CEDAW in the global South. And in September 2022, Eurasia Pacific, alongside 28 partner organizations, convened the Global Tribunal of Women Workers during our annual Global South Women's Forum. It was a cross-sector, transnational, collaborative initiative which set out to, one, make visible the very broad spectrum of women's work, and two, the continuous rights violations that happen for women in the world of work. It was a space, one, to demand accountability from duty bearers, whether it be state actors, non-state actors, employers, and even CSOs. And two, which was probably the more, the one that stuck out more, was a space to generate solidarity. And it focused on 5 thematic areas, one of which was care work, social protection, decent work, and informalization, because as spelled out with the different conversations we had today and also with Myra's, the feminist agenda sees care work and the care economy as a human rights issue and a women's human rights issue specifically. So the Global Tribunal hosted testimonies of 73 women workers in Asia, Africa, and Latin America, and also in North Africa and the Middle East. And from 12 different work sectors, including domestic workers, factory workers, migrant workers, street sweepers, and vendors, and of course also care workers, both paid and unpaid. The outcome from the tribunal was a set of recommendations, as I said, targeting duty bearers, primarily the state and corporations, and also civil society. And as mentioned, the primary objective was to make visible the human rights violations that goes on in the world of work for women. But an unexpected objective and an unexpected learning was the very visible impact of storytelling. Because we worked with 28 organizations across all these regions at different levels. So we worked with international organizations like ITWF, who is here with us today, and also with regional, national, and grassroots organizations to connect directly with their constituencies of women workers and co-produce testimonies in a tribunal, or because there's a quasi court situation, we collected testimonies, which is basically stories. But working with the women workers and with our collaborators, we didn't see it as a data gathering process. Instead we viewed it as collecting stories and accounts and lived narratives and lived experiences, right? But reflecting retrospectively, the stories, realities, lived experiences, and accounts of daily lives are data, but just not in the way that we have grown accustomed to. So the tribunal, if you look at the bigger picture in research terms, was a data collection and analysis process for the formulation of policy recommendations. But the point that I would like to stress is that yes, storytelling is an important form of data and evidence collection, but more important than that is to take into consideration how it's done. Considering that the end product of the tribunal, and I'm using the tribunal here as a case study, was the recommendations. We do not want the evidence gathering process to be extractive, which I think is the biggest thing that we need to be aware of in research. So we didn't want to do 2 things. The first thing that we avoided was discounting the agency of women workers and care workers and assign them to the role of victimhood, or in the need of saving, or the need to have their stories told on behalf of them. And 2 was just using their stories for the purpose of the tribunal and limiting their participation there, at just telling their stories. So we consciously and intentionally, keyword is the intentionality, avoided this thinking by very importantly recognizing the agency of women workers as generators, keepers, and holders of knowledge, specifically when it comes to their narratives and their struggles for their rights. So when working with the women workers to develop their testimonies, yes, we ask them, what are your stories? What are the right violations you face? What's the day-to-day in your field of work and in your world of work? But we also very clearly ask them, what are your recommendations and what are your demands from the duty bearers? Because they don't get the opportunity to directly voice out their demands. You know, everyone goes to them for stories and tell us what goes wrong, but never what do you want changed. So, because at the end of the day, they know best what they need. And we cannot make the assumption for them, we have to listen to them. And it was that input that helped our jury, so we had 5 jury working groups, develop the recommendation. So it was taking it one step further when we facilitated their participation in the policy formulation process. And it also helped break the uneven power imbalances that exist in research, which is between the researcher and the researched. So specifically when it comes to concept of care work, sometimes care work and care workers, sometimes the data gathering process can be a little bit amorphous because care work itself is a little bit amorphous because it's learning about how care workers and women spend their time between paid work and unpaid care work, even paid cat work sometimes. And it's about, it's about their day-to-day lived experiences, their day-to-day interactions with their families and communities. It's about who they care for, how they care, how much they care, and how their day goes. And undeniably, there exist many, many tools, as Mara just shared, and also the esteemed colleague from Philippines, like time use surveys, but storytelling is a very strategic way to humanize the people behind the numbers, behind the percentages, behind the statistics. It gives a face and it gives lives to all the different figures that we see. And it helps the women, in their own words, to tell their own narratives in their own context with nuance and intersectionality. So, and also that's how you get the stories of violations of rights and what they want better change. Storytelling not only captures their lived realities, but as I stressed earlier, also their demands, which perfectly complements other data collection methods for advocacy. So I'll wrap it up quickly because I'm the last speaker of the last panel. I want to keep you here long. So to end that part, right, we hear the stories of care worker every day. We don't really hear them, we see them. What we just need to do is to pause, stop, and reframe the way we think about data collection when it comes to care. And not only listening, but meaningfully engaging. That's like the next step, right? It is at the end of the day, it is stories that shed a light on issues. It is stories that shed a light on violation of rights, and stories that inform policy and advocacy, and we must not discount the power of stories in shaping our ways of thinking and our ways of working in data and research collection.
So thank you, Praveen. That is very interesting. So there is indeed a huge difference between looking at a set of data and actually hearing the stories behind those data. So it kind of gives you the humanity of it, the humanity of numbers. Yeah. So in your experience, have there been? Can you share with us if there have been any successful? This approach has been successful in how did the policymakers accept the recommendations that we distilled from the stories of women? Because sometimes there's a very rigid outlook, like, okay, this is not research, this is just in the Philippines we call it chismis, it's hearsay, so it's just a story. Yeah, gossip. So what's the reaction so far?
Well, reactions of policymakers, I actually don't have an answer because, as CSOs, the biggest challenge we face is getting policymakers to come for our events. Alternative spaces, developed by feminists, developed by civil society organizations. So that is one thing that we could work towards sort of fixing, to make sure that stories are heard, not in a vacuum, but making sure the stories get to where they need to go. But from the tribunal, the bigger thing that we saw, as opposed to stories being heard by policymakers, was at the end of the day, just a solidarity generated and listening to other stories, because we're silently 3 women. But at the end of the day, just because one woman delivers one testimony, it doesn't mean that's only hers. It's a shared story. It's shared with the community. It's shared it's the same story of the other women who work in the factories, the other street vendors who work on the streets. So it was that sense of solidarity of, one, getting your story heard in the first place, which is something that many women don't get access to and don't have the privilege. And 2 was being able to hear the stories of other women like you, to know that there are many more like me out there, and there are many more struggles like me out there, and we can all convene under one shared umbrella of struggles. So that was the main impact of storytelling. So unfortunately, I don't have a direct answer to your question, but I only have one final thing to say, which is that we have to listen to the stories. Yes,
Yes,
thank you.
indeed. Sometimes we just need to be good listeners. So thank you, Praveen. Round of applause for you. So there you have it, Excellencies, ladies and gentlemen. Very insightful experiences from the perspective of the government, from research think tank, from CSOs, and from organizations working with the grassroots. Before I open, I invite anyone for questions. If I may just ask the organizers, we have time for that, because I know we are running 1 hour behind. One question. Okay, we will take one question. Any questions from the floor so far? Looks like everyone is looking forward the welcome dinner. Huh? Yeah. So going. God, I think it's very clear, right? So in case any question pops up, we can chase Deputy Director Christine, Myra, and Praveen. Of course, maybe we can send an email to Dr. Chupra because she's virtually joining us. And thank you so much to our distinguished panelists for taking your time to, and sharing with us your stories. Thank you very much. Let's give them. Thank you very much. And I am turning the floor over to Madam Master of Ceremonies.
Thank you, Mr. Subert, at the esteemed panelists for sharing our values insights. And now, ladies and gentlemen, now we are at the end of the day 1 for the meeting today. After this, we will have a welcome dinner together at Tam Nak Lao restaurant, where we can discussion and we can relax and share the experience in good dinner, good food for us. So on behalf of the organizing committee, I would like to thank all for the sparing and your valuable time to participate today, meaningful meeting, and also wish you all enjoy to stay in Laos. And thank you very much for the participants that to join online. Last but not least, may I briefly about the plan for tomorrow. Tomorrow, the meeting, we will start at 9 o'clock until 12. And then the afternoon session, we will go to visit some place. And then for the place to visit on afternoon tomorrow, I will ask the team to explain about the place.
Thank you so much for giving me the floor. So I would like to give you the overall agenda about tomorrow, because in the afternoon session, we're going to have the field visit with the HomeNet Laos, the home-based worker, to sharing their experience. And after that, we got 3 options for you, either going to be the cultural, historical, or even the contemporary art museum to go. The first one going to be the Vientiane Museum of Contemporary Art. If you would like to visit this, or the next one going to be Phat Luang Stupa. This one is going to be our cultural visit site. If you come to Vientiane, you need visit this one. And the last one gonna be Patusai Monument. This one we gonna arrive soon at the late evening, so you can see the fountain there as well. So we can take the picture. Tomorrow, if you know like which place you would like to visit, our team at the registration stage gonna give you the box to tick like which one you would like to go. And then we can arrange the transportation for you. That's all for today. Thank you so much.
Okay, thank you. And now we have 30 minutes for like prepare something so for your, and then 5:30 we will meet at the lobby, and we will go to the Tam Nak Lao restaurant. That's for the yes 5:30 at the lobby. Yes. Okay, enjoy. Thank you.
See you again tomorrow.